look at patients in recurrent and we say platinum resistant, platinum sensitive, some people are saying the better term at this point is platinum not eligible. We're trying to evolve that terminology of platinum resistant, but when you look at the trials that have been done in platinum resistant, the real trial was a great trial. It was very, in my mind, real world, where patients were either going to get treated with chemotherapy or chemotherapy and Avastin that recurred within 6 months. And it was the treating physician could choose between three choices of chemotherapy: weekly Taxol, topotecan, or Doxil. So to me, I thought that was a real world trial that we as clinicians could apply to our patients. And what you saw an improvement in their response rate, you saw a doubling of the progression-free survival, and you saw control of ascites. So to me, in patients who have platinum-resistant disease, I think that Avastin is one of the most important drugs for them, and combining that with chemotherapy does improve their progression-free survival, helps control their symptoms, and increase their response rate. And again, it's a safe drug because when you think of platinum-resistant disease, we had talked about signs of bowel obstruction and having diffuse disease within the abdomen, higher risk for bowel obstructions, bowel perforations. What you saw is that in the real trial that these patients tolerated the regimens very well, and again, doubling of the progression-free survival in a difficult group of patients to treat is very, very important. I would say in the platinum-resistant setting as well as the platinum-sensitive setting, we're having studies now showing that bevacizumab after bevacizumab is safe and effective. So to me, I would use bevacizumab after bevacizumab. There's data in colorectal. The Midomango trial, which was presented at ASCO last year, showed that bevacizumab was safe and effective in the recurrent setting and using it up front as well as in the recurrent setting. So to me, I think it's important that we always keep in the back of our minds that this is a very well tolerated drug. It's safe, easy to give, and patients can take their treatment upfront setting and the recurrent setting in both the platinum sensitive as well as the platinum resistant stage. I think that Avastin is a great drug. Bevacizumab is a great drug. When they developed it and it was a phase 2, we saw excellent response rates. And when you look at the totality of the data for ICON 7, GOG 218, GOG 213, which is platinum sensitive recurrent, the OCEAN trial, which is platinum sensitive recurrent, and then the AREAL trial and the platinum resistant recurrent, what you're seeing is a drug that improves the response rates, improves the progression-free survival in specific studies. In GOG 213, it was a statistical significance improvement in overall survival. So the totality of the data shows that this is a very safe drug. I was fortunate enough to start using it back in 2005, 2006, and I've always been a firm believer in maintenance therapy. To me, I've always wanted to treat low-volume disease, to try to improve each progression-free survival 1, because to me, once we start improving all those progression-free survivals, that's when you're really going to start to make an improvement in overall survival. So I think overall survival at times is very challenging to look at, but to me, it's always, if we can improve PFS 1, then let's work on improving PFS 2, and then we're going to have really long, durable responses.